can you help us understand the role of valves in the heart and what can possibly go wrong with them?
Absolutely. Absolutely. This is very important. As to tell you, heart has four valves, two on the left side and two on the right side. So there are two chambers, upper chamber and lower chamber. There is one valve between these chambers, and then the main exit valve, which is the aortic valve. The valve which is in the between the upper chamber and the lower chamber is called the mitral valve, and this main exit valve through which actually the heart pumps all the blood to the body is known as aortic valve. So now how these valves can go wrong, this is also a widespread thing, and we need to understand this at length. There are many diseases which can affect and implicate the valves. It can be some infections which happen during the childhood stage and can implicate the valves in terms of they can deform the valves and they can make it narrower, or then valves can start leaking. So both the things are putting a huge strain on the heart. So this childhood infection which leads to these deformities in the valves is known as rheumatic heart disease. But there are other stuff also, like what we have been talking is at times this main exit aortic valve is affected and become diseased or deformed with the advancing age. So this is known as degenerative aortic valve disease. So this disease happens usually after 60 years of age. You can well imagine the valve function is practically that it opens and closes in all cardiac cycles. So how much work the valve is doing throughout our life. Once it opens, once the chamber is pumping blood, it opens and blood is exited, and in the next cycle of the cardiac cycle, so that the whatever blood is exited out, it should not come back to the previous chamber. It has to close, and it has to close very efficiently. If it doesn't close efficiently, it will produce a leakage. So this is the disease. What I am talking is that once with the advancing age, because of too much of stress on the valve throughout 60 years or 50 years, 55 years, it's constantly functioning at the same rate, no respite to the valve cusps, the curtains of the valve become thickened. So they thicken, and so that once they become thickened, the opening which should be like this now becomes very small. It becomes narrow, it becomes shrunken. So that shrunken valve is putting a lot of strain on the previous chamber, as chamber is trying to exit the blood through that valve, but the opening is now narrowed. So the strain on the previous chamber increases. Similarly, if this closure of the valve is not efficient, it will lead to leakage. Now leakage will also dilate the previous chamber and put strain on the heart. So we can actually see the valve deformities in the form of either narrowings, which is called stenosis, or the leakage, which is called regurgitation. Both are very bad for the heart, and they put huge strain on the heart, and heart starts to fail. So once this happens and heart dilates and starts to fail, it leads to a lot of miserable symptoms to the patient.